Hi Sudha, how are you?
Hello Durga, I'm good, thank you.
Yeah, let's come and let's have a seat.
Hello friends.
This is my dear friend Dr. Sudha, who is a senior gynecologist and obstetrician and a laparoscopic surgeon at Virinchi hospitals.
And she's my friend Dr. Sri Durga. She's a fertility specialist at Virinchi Hospital.
Sudha, March has come, so we know why March is popular for our ladies.
I know, you might have noticed we are wearing yellow badges.
Yes.
That is for Endometriosis Awareness Month. March is considered as Endometriosis Awareness Month. That's because, as you know, there is a worldwide 180 to 200 million people suffer from endometriosis worldwide. And incidence, Durga?
Yeah, that's a quite alarming figure, and I mean, 1 in 10 women, Sudha, they suffer from this disease. It's like a small scale epidemic, isn't it?
Yeah. And it's increasing, and there is a delay in diagnosis.
Yeah.
Because of the symptoms are not correlating with the signs.
And the prevalence is as wide as 10 to 40%.
Exactly.
Yeah, like you were telling about something, the diagnosis getting missed.
Yeah, that's because people with pain during periods, actually this endometriosis, they complain pain during menses, so they most of them consider it is normal, or they suffer in silence, or they go to the general physicians or take over the counter medication for it. So it goes unnoticed for a long time, right?
Yeah, and it typically takes a decade, at least a decade for correctly to put the diagnosis as endometriosis.
That's true.
Yes. And usually I think when the patients come to you, and usually I think let's say a physician or somebody refer to you, and or they directly walk into you, and usually we get referral from gynecologists rather than patient directly walking to us. So when you find these symptoms of and you think it is endometriosis, you normally you trust the scan, or you want to do something else?
So most of the time, 80 to 90% of the time, ultrasound will help us.
Yeah, definitely.
But sometimes we need an MRI to diagnose it. And but the most diagnostic will be in mild and very mild and minimal lesions. Nothing could be seen on scan or MRI as well.
Yes.
So the main diagnosis, as you know, is laparoscopy. Where
that's a gold standard.
That's the gold standard. Where when we diagnose, if we diagnose it as minimal or mild endometriosis, we can treat them at the same time, fulgurate them or burn them.
Yeah, basically. And usually when they come to, when you people refer to IVF fertility treatments, they have gone beyond this minimal and mild disease.
That's true. That's when we refer them to you, right?
Yes. And most of the time they come with this huge chocolate cyst, whatever size the chocolate cyst. And what is your take on when you see you've seen a scan and you've taken them for laparoscopy, you've seen a endometrioma chocolate cyst. What we want, the IVF specialists want to be as gentle. So what is your take on dealing with this endometriomas, chocolate cyst?
Yeah, actually that's a good question. That's very interesting and tricky one as well.
Yes.
So if the see, depending upon symptoms, if the person has finished family and they have pain, so the size of the cyst is more than 4 to 5 centimeters, we'd like to take it off. But if they come to us for infertility, then that's a tricky case where 4 to 5 centimeters. Less than 4 to 5 we definitely would not touch. That's what you agree, right, Durga?
Yes.
So more than 5 to 6 centimeters, we have to do surgery.
And is there any secret you want to share with the laparoscopic surgeons? How gently can a gynecologist be in removing this?
Yeah, there are two sides of the coin. The first thing is, the first surgery should be the best surgery. We don't want any recurrence because they are prone for recurrences. At the same time, gentleness at the surgery, in the sense we should not do cystectomy. The best thing is drain and take out the cyst wall so that the cortex is not damaged, and we'll give you the person with we'll give the hand or the patient to you with good mature follicles.
Yes.
Good follicles.
Yes. And this problem, Sudha, it's not just fertility, or it's even we are observing, the girls of our daughter's age, teenage girls, there's adolescents.
Yes, Durga, because of the xenoestrogens in the atmosphere, because of the increasing incidence of estrogen-like substances which come from plastics, chemicals, pesticides. We are seeing nowadays girls attaining menarche earlier and ladies reaching menopause very late. So this long duration of exposure
more
to
cycles,
more cycles. Estrogen is causing all these problems.
And
right?
usually these teenage girls don't come to us. We are fertility specialists, and they only come to us when they need a child.
That's
I think they usually land up with you gynecologist.
Yes.
So how do you, like, let's say the patient didn't come fertility, how would you sort of you'd like to manage them with tablets or painkillers, isn't it?
Yeah, definitely. The initial line of treatment should be medical. As such, actually, there is no cure for endometriosis, as everyone knows. So we have to treat the symptoms with which they come to us with.
Yeah.
So most of them it is pain. So painkillers, NSAIDs, and hormonal treatment like progesterones and all. So would do
Especially
good.
for these adults and girls and this
Adults,
generation.
Yes.
Yeah, contraceptive.
Pills also. Next line is
Dual
contraceptive
purpose it
pills.
solves.
That's true.
Yes.
That is true.
But one my opinion, Sudha, on this, I've seen few girls with big chocolate cysts, and already they're 17, 18, and the reserve is already compromised. Usually, and they're symptomatic, and I can't say, you just keep quiet and suffer like this, because these are young girls, active lifestyles.
True.
And I'm worried these girls might struggle with pregnancy later. So, and my opinion in these cases is still they have to come to a fertility specialist.
That's true.
That's where I think we can offer them social egg freezing.
Yes, which is in the pipeline actually.
Yes, yeah, it's like fertility preservation, not for cancer, but for something.
That's true. Now with the advanced age of marriages and delaying their child, definitely.
And it is a
egg freezing,
progressive disease.
It's a progressive disease.
Yes,
That's
it's
true.
not going to stop at that point.
That's true.
So-
Because this endometriosis is a problem where it causes anxiety, depression because of the pain,
Psychological
infertility,
issues.
and it reduces the quality of life of the
Definitely.
person as well. That leads to the house atmosphere also is,
Yeah, definitely. Lady
It
of the,
affects the life. Yeah,
the lady
yes,
of the
yes.
house has to be happy first.
Yeah, that's true.
And
Because she's the
especially,
backbone, as you agree.
yes, definitely.
Yes.
And this on this topic of adults, and we'd like to freeze the eggs. And yeah, if you're still not able to cope up with life, that's when you can. I think you can be, I don't know, aggressive or gentle with this chocolate cyst, because now we got something from her for her future fertility. And like you mentioned, small chocolate cyst, I don't think.
Yes, we don't need to disturb them. Let them go as they
And
are.
even for us IVF doctors, we don't find them they're coming in the way of egg collection. But definitely this more than 4 or 5 centimeters, that's when we need your help to sort out the cyst or to get access.
We'll be more than happy to help you.
Yeah, definitely. And typically when doing the egg collection, usually sometimes we graze past this chocolate cyst, and we send this follicular fluid, which is brown colored, chocolate colored, and our embryologist they don't like it. So yeah, we'll just hear it from our embryology friends as well. Dr. Satyavan, our embryologist, will tell you. Dr. Satyavan, our embryologist. So Satyavan, tell me, when I send chocolate fluid, brown colored fluid, I don't see you that happy. Why is that so?
Actually, I'm a chocolate lover. I'm very happy with the chocolate, but in our IVF department or in embryology lab, I'm not happy with the chocolatey fluids or brown follicular fluids, because that the compromise, we have to compromise with the oocyte quality. Some like we get the chocolatey fluid. It has the patient with the endometriosis and all and all the oocytes are very poor, the quality, yes, and it has the fertilization rate is very low. So that's why we don't like the chocolate or brown colored fluids in our lab.
Even if egg is not that good, it might not lead to even good
No.
embryos.
If sometime we getting some good like not good quality, like a middle way, but
Some of these eggs
yes,
might be bad.
yeah,
This chocolate fluid.
yes, the fertilization rate is very low,
And even the
and
outcomes
even the
might not be
fertilization is very
good
yes.
embryos.
So that's why we don't do that. Yeah.
And my duty ends with they're lucky and they have good quality embryos. My duty ends with their pregnancy. I think later the obstetricians, it's your nightmare or whatever, your joy with their pregnancy starts.
Well, I think endometriosis, people with endometriosis, the prognosis is quite good.
Yeah.
So there are not much problems with people with endometriosis concern. But I'd like to tell people that the sister concern of endometriosis is adenomyosis, where we see the endometrial tissue inside the uterine cavity. These people, their pregnancy outcome might be poor in view of defective placentation and all. So they might have early miscarriages or preterm labors or premature rupture of membrane or even intrauterine growth restriction as well.
Yeah.
So those cases we have to be a little careful, we have to explain to them and they need close follow-up.
Yes. This is whatever we call is adenomyosis, the endometriosis of the uterus.
Yeah.
Even we find that even these women, if they get lovely embryos, sometimes they don't like, these embryos don't like to get attached, implant to this adenomyotic uterus.
That's what that is because of the junction layer is defective and then the implantation and regeneration will be defective, right?
And, it starts from beginning, I think, and
the process and all. I also wanted to tell you one thing. Okay, the basic feature behind all this is inflammation. Nowadays, even in obesity, they say it's inflammation.
Everything is, yes.
So I think apart from all these medical management and what we have talked about, the diet and life changes also play a very important role, especially for young adolescents who are, should be aware of the diet and exercises, eating good.
I hope they listen to us and follow the advice.
I know.
How many
Because
of them listen to good healthy lifestyles?
That's true, because there are certain anti-inflammatory foods like lots of fruits, vegetables in the diet, and lean protein and taking good amount of fiber. All this, I think, lifestyle, little exercise, diet, and aerobic exercises along with muscle strengthening. That goes a long way in preventing all these problems.
Yeah, let's hope the solution to endometriosis would get more simpler in the future.
I know, let's pray.
Yes, but usually, with this more increased scientific knowledge, I think these cases are getting picked up more quickly.
That's true.
My mother, when she's a gynecologist, she never heard of this endometriosis during their post-graduation days.
For that matter, even PCOD,
Yes,
which we used to start at the starting of the career, we used to see for 30, 40-year-old people. Now we are seeing for...
When during our post-graduation, hardly we encountered any endometriosis case.
That's true.
But nowadays it's become so common.
That's because of the environmental changes, the westernization, the sedentary life.
Well,
everything is
like I mentioned previously, we are picking up more cases because of all these improved diagnostic technologies.
True.
Yeah. So let's hope it doesn't become a small-scale epidemic and somehow these young girls start listening to professional advice as well as to their mothers and something can help them, at least the diet modification or at least we can't control environment, but at least if we can control.
Yeah, the basic idea behind this awareness is to come out early, at an early stage to us, so that we'll be of help to them.
Yeah. So Sudha, 14th March, remember, it is the endometriosis day, so we both are going for the walk. Yes, so remember that? Yes, so you are in?
Yes.
And hopefully all our friends will be in as well.
Yeah, joining us.
Yes.
Thank you.
Very good.